I want to welcome you all tonight to our special meeting in Chapter 422 here at our new home at the Laurel Senior Activity Center. If you get a chance there, take a walk around because it's really fantastic. The meeting is being videotaped tonight for future showing on Laurel Cable Television Network. And if you haven't already done so, please make sure you sign in over there at the little round table coming in the front door. And also, please turn off your cell phones. It's not going to upset me, but I don't want to hear cell phones going off when the senator's up here speaking. At this time, I also want to welcome the following individuals who are attending tonight's meeting. Please stand when I call your name. Maryland Delegate James Hubbard from District 23. The following North Maryland Federation's officers, chairman, representative, and chapter presidents. We have Dick Strombotny, Maryland Federation treasurer and past president. Marty Strombotny, assistant secretary and registrar. James Cowie, chairman of the Federal Legislation Committee. Okay. Jackie Robinson, I know she's there and she's still standing. She's convention co-chair and our chapter program. Doug Newton, who is also convention co-chair. Frank Chase, who is our representative for Senator Cardin. Frank Sel Arjuri, who is our representative for Congressman Boyer. He's here. Oh, there he is. Stand up. Chuck Thomas, our representative from the United Seniors of Maryland. Marcia Swanson, president of Chapter 1888. Verdell Dowdell, president of Chapter 1734. I also want to welcome any new members and first-time meeting attendees. And this is for my own curiosity. How many people here that are members of Chapter 422, is this the first chapter meeting you've attended? Raise your hand. Okay, at this time, can we all stand and say the Pledge of Allegiance, please? At this time, it's my pleasure and honor to introduce our speaker tonight, the Honorable Benjamin L. Cardin, United States Senator. Ben was first elected to the U.S. Senate in 2006. From 1987 to 2006, he represented Maryland's 3rd District in the U.S. House of Representatives. Prior to that, he served in the Maryland House of Delegates from 1967 to 1986, and served as the youngest elected speaker of the Maryland House of Delegates from 1979 to 86. He graduated first in his class from the University of Maryland School of Law. He's a national leader in the environment and protecting the Chesapeake Bay, and is a champion for civil rights, health care, and retirement security. Ben's priorities include the economy. He understands that creating jobs and growing our economy is paramount to our national recovery. The Chesapeake Bay, his support for the Bay has been one of his signature issues, and we all thank you for that. Health care, he continues to promote life-saving preventive services and research, initiatives to erase disparities in minority health, and policies that will help maintain the highest quality of America's healthcare system. And last but not least, working for Maryland. Ben works every day to ensure that the federal government is attentive to the issues of unique concern to the people who live and work in Maryland. This includes includes looking out for federal employees, protecting resources for federal agencies headquartered in our state, helping small businesses navigate contracting and credit issues, protecting our environmental and cultural treasures, and much more. The Washington Post has said Ben Cardin has a command of issues, proven integrity, formidable intellect, and an unsinging work ethic, and that he is sensible, tough-minded, and independent. The Baltimore Sun has said that he has been able to work both sides of the aisle to help workers save for retirement and to champion the expansion of Medicare benefits. At this time, I'd like to give you our United States Senator.
Bill, thank you very much for that very kind introduction. I'm not used to those introductions, and I don't get that greeting on the floor of the United States Senate, so I thank you very much. It's good to be among friends. You know, this is a friendly group. This is a beautiful facility. First time I've been here, I tell you, I am impressed. So this is very, very nice. I know you should be very proud of having this here in Laurel, and I'm proud to represent you in the United States Senate. I'm going to talk a little bit about some of the pending issues, and then I would very much invite your participation. Frank Chase is here. I only mention him because he's on my advisory committee on health issues, and he's helped me a great deal on retiree issues. So if you're going to ask any really tough questions, I'll yield to Frank. Get prepared. I know his background will help me in dealing with that. Also, let me tell you, I'm proud of our federal delegation. Bill was very kind to talk about the federal workforce, and I'm going to talk about the federal workforce because it's under attack. But I'm proud of my colleagues in our federal delegation. There's no stronger friend of the federal workforce than Steny Hoyer, the congressman from this district. He has set the standard for us on the federal workforce issues and raises it at the highest levels, including the President of the United States. And I applaud him for his advocacy for the right issue. And of course, Barbara Mikulski, my colleague and friend, and longest serving female in the history of the United States Congress, is there every day fighting for these issues. So I have great partners in our federal congressional delegation. I just really wanted you to know that from the beginning. I start by saying thank you. And I mean that. Thank you for your public service, what you've done to build this great country. America is known for a lot of excellence in what we do. We have established the standard for democracy internationally. We have stood up for the right values. We have the fastest growing economy in the history of the world. And the list goes on and on and on what we've been able to do. We've had more innovation, more creativity, but we've also had the best governmental service in the world, the most efficient governmental service in the world. So I start off by saying thank you for your public service. Thank you for what you've done for the people I represent in Maryland and our nation. I have visited our federal facilities, and I've seen the best of the best. Whether I've been able to get to FDA and see the way that we provide for safe food in our community, so people can go to the supermarket with confidence that they won't get sick, or what we've done to protect water quality in this country, so when you turn on your faucet, you have confidence that the water you're drinking is safe for you to drink, or what we do in NIST in developing the best technology and the way that we can evaluate technology in the world done right here. NSA, what we do in order to keep us safe from terrorist threats, or what we do on border security, and the list goes on and on and on. What we do with the Social Security Administration. We have the best system for protecting our seniors so that they can live with dignity in this country. It's done very professionally. And yes, on this tax day, this is, as you know, the deadline is midnight tonight, the IRS, they do their work in a very professional manner. And I'm proud of what they do. Now, the Congress has a strange way of saying thank you to our federal workforce and our retirees. You're constantly under threat. It's a war out there. And I want to tell you a little bit about it because I think it's totally unfair the way that the federal workforce is being picked on by certain people in Washington. First, let me tell you that I think the federal deficit is a very serious issue. I tell you that as a member of the United States Senate and a former member of the House that voted against the policies that led to this fiscal mess. So I can say, I didn't cause this, but we have a responsibility to fix it. But we need to understand why we are so far out of balance, so we don't make the same mistakes again. And if you go back just 11 years ago, I want you to go back 11 years. I want to go back 3 years ago. So 11 years ago, when George W. Bush took the oath of office as president, he inherited a budget surplus. Not a small surplus, a huge surplus. A surplus that was so large that economists were scratching their heads and saying, we're going to pay off all of our publicly held debt. Then what do we do? What a problem. I love that problem today. So we had huge surpluses. We had an economy that was growing by record amounts. Job growth was just, everybody wanted to find a job, would find a job 11 years ago. The United States had the best international reputation. We were respected around the world. We were moving forward with peace in Northern Ireland, and we were making progress with American values around the world. That's where we were just 11 years ago, people. 11 years ago. And public service was a respected profession. Our federal workforce was respected. They were getting the type of support they needed in order to improve quality. We were treating our federal workforce fairly. And then what happened? Well, the policies were changed. And I disagreed with those policies that were changed. We found ourselves with a situation, with an administration that said we need to cut taxes. And I said back then, let's not cut the taxes until we know that the revenues are really going to be there. But no, we went forward with a large tax cut, primarily to those who didn't need it, quite frankly, reducing the upper rates. We then found ourselves in a very difficult circumstance, the attack on our country on September the 11th. As a result of the attack on our country, the President ordered our troops into Afghanistan, and I certainly understood that and supported it. After all, it was Afghanistan that was responsible for those who attacked our nation. Then the President ordered an attack on Iraq, which I did not understand, because there was no information that Iraq was involved in the attack on our country. And we spent hundreds of billions of dollars with military operations in Afghanistan and Iraq. And the President then called upon America to do something else. Now, every other president during a war asked us all to dig into our pockets and be patriotic, pay a little bit more in taxes, preserve our resources so that we can have the military might we needed to get through the war, but not President Bush. Instead, he suggested a second tax cut. That second tax cut was passed by Congress, not with my vote, again to people who basically did not need that tax cut. And that large surplus I told you about became a huge deficit. And America was engaged in 2 wars with no end in sight. And by the time that Barack Obama took the oath of office 3 years ago, this nation was losing 750,000 jobs a month. Our economy was on the edge of going off of a cliff. The deficits were as large as we've had in modern history, and the prognosis was not good. That's where we started 3 years ago. And yes, President Obama added to that deficit. He did, because he did what every economist said he should do, and that is spend money to get us out of the recession. Invest in public infrastructure. Invest in our roads, our bridges, our energy systems. That's what economists say, in a recession, you need to prime the pump. And the American Recovery and Reinvestment Act created millions of jobs. And our economy was turned around. He did bring our troops home from Iraq. That helped. We're not spending the money today that we were spending a few years ago with our military presence in Iraq. He turned our economy around. We've had 25 consecutive months of private sector job growth. That's good news. But we have these huge deficits out there. What are we going to do about bringing our deficit under control? We have to do it. It's not sustainable. Our budget deficits are not sustainable. A great nation should pay its bill. It's morally wrong to ask our children and grandchildren to pay for what we're spending today. We have that responsibility to pay off these bills. But I went through this long explanation to tell you how we should do this, and not the way that some are suggesting in Washington. First, I want to talk about the argument that our federal workforce is being paid too much, and that our retirees are being paid too much. That's absolutely false. False. First, our federal workforce has already stepped up to the plate and made huge sacrifices in order to try to bring about a more fiscally realistic budget. They've gone 2 years without any pay increase. 2 years. They've seen a shrunken federal workforce to do more work. So they're doing more work with less people. And as I went through how the deficit was caused, it was not caused because we're paying federal workers too much, or retirees too much, or we had too many federal workers. It was caused by these tax cuts and these wars that we didn't pay for. So don't pick on the federal workforce when they're not at fault for where we are today. Let's look at what caused the problem. Second one, there's been some studies that say that the federal workforce is overpaid. That's absolutely false. And we got to counter it. The study was very pointed out very clearly, their study that they're using, that if you look at those that are in the average wage category and the higher wage category, they're in fact underpaid compared to the private sector. Underpaid compared to the private sector. Because the federal workers, if you're doing research at NIH, or you're doing border security, the work you're doing is more significant than someone who's working for a private company. So a federal worker doing that type of work is not doing comparable work, it's doing more intensive work. And therefore should expect to get a higher compensation. In fact, they're getting a lower salary. And part of it's made up through fringe benefits. But when you look at the federal government's health policies and retirement plans, it's comparable to a large company. It may be better than some small companies, but collectively, federal workers are not overpaid. The only area where the studies show that we might be treating our federal workers better than the private sector is on the lower paid workers. The lower paid workers. I tell you something, I don't want to race to the bottom here. I'm proud that we provide our federal workforce with health benefits. And I'm sorry that low-wage workers don't get health benefits from their employers. They should. They should. The federal government should set the example. We have a shrinking middle class. We need a growing middle class. An economy that's going to be strong is one that has consumers who can afford to buy automobiles. It was Mr. Ford who observed. Henry Ford observed when he was talking about how he wanted to make sure his workers got enough pay. So I want to make sure that my workers have enough income to be able to buy the car I'm manufacturing. And Mr. Ford made a lot of money. But he wanted to make sure his workers got fair compensation. We've got to do the same thing. If this nation is to grow, we've got to make sure that our working class get the incomes they need so that they can be consumers and that we can have a growing economy. And we have a shrinking middle class. So what you hear about the federal workforce is just absolutely false from our opponents. And I'm going to take issue with them every time they try to bring up these issues. So how should we be dealing with this budget deficit? We need a balanced approach. A balanced approach. So what are our opponents doing? Every opportunity they have, they're trying to dump on our federal workforce. I served on a conference committee that dealt with the payroll tax extension. I was on that conference report with Chris Van Hollen, our dynamic congressman from Montgomery County. And what we were dealing with was a desire to extend certain payroll tax holidays in order to get our economy back on track. It's the right thing to do, and to make sure the Medicare system, our physicians, got a reimbursement that was reasonable, and that we extend unemployment insurance. All those were reasonable things to do. But what did some people want to do? They wanted to offset that by having our federal workforce take another year of a pay freeze. They wanted to reduce the retirement benefits, increase the amount that we contribute to our pension plans, do all of the above. And we said, well, there's a better way of dealing with this. If you're going to offset this, and we questioned what we needed to, but if you're going to offset it, wouldn't it be better to ask the millionaires and billionaires to pay a slight surtax on their income? Now, look, we're not picking on wealthy people. I like people making money. But these are the pure facts. This is facts. If you look at who has benefited during this recession, whose incomes have gone up and whose have not, the income of the highest income brackets have gone up the most during this recession. They're doing very well. And their rates are the lowest tax rates in modern history. What we're talking about is basic fairness. Basic fairness. Shouldn't they pay a little bit more in order to deal with our budget needs? So when I talk about a balanced approach to deal with our budget deficit, I am talking about an approach that was first suggested by the Bowles-Simpson Commission. I don't know if you've heard of that commission or not. That was a deficit commission that said, look, we've got to get $4 trillion of savings over the next 10 years. We'll come in with a plan. Nobody really liked all that much. But what they did was they had a balanced approach. They took $2 trillion, half the money, by saying we're going to increase revenues. That's a polite way of saying we're going to increase taxes. Because if you spend the money, you should pay it. And you pay it through taxes. That's a fact of life. Historically, when we balanced our budgets, or came close to balancing our budgets, we've had about 19% of our economy in revenue. That's what we did during Bill Clinton's days. We had about 19% of our economy in revenue. By the way, when Ronald Reagan was president, we had about 19% of our revenue, of our economy in revenue. We're now about 15%. So the debt commission said, let's get back up to 19%. Okay? We can close loopholes and do it. We can eliminate the tax breaks for the highest income. We can eliminate the tax breaks for oil companies that don't need a subsidy. They're making record profits. Record profits. They made in the first 3 months of last year, I don't have this year's numbers, they made $124 billion in 3 months. And they get a $6 billion annual subsidy for the federal taxpayers. It makes no sense at all. So those types of things we can eliminate and bring in the revenue. So we can bring in the revenue through a balanced approach that will be fair for all taxpayers. Won't hit the middle class. The middle class already hurt. And then we can reduce costs. We think we can do that in the healthcare system by delivery system reform, keeping people healthier. We started that with the health reform bill. Our wellness exams, so that our seniors have wellness exams that are now paid for under Medicare. Preventive care, by getting hospital infection rates down, you can save billions, hundreds of billions of dollars. We know the protocols for doing that. Reduce readmissions to hospitals. We know how to do it. The problem is a lot of people are discharged from hospitals without having adequate information on how they stay healthy. They don't know how to deal with it. Care First in Maryland is going to send nurses home with patients being discharged at their own cost because they know it's going to save them money. At the end of the day, it will save them money. So we need to have a delivery system that's befitting the healthcare of America. That will save us hundreds of billions of dollars in healthcare costs in this country. And yes, we can reduce agricultural subsidies, particularly to those large farming operations that are getting government subsidies. Make no sense at all. My point is this. We can come up with a bipartisan plan to balance our federal budget again, clean up the mess that's been created over the last 11 years from, I believe, ill-conceived fiscal policies that cut taxes when we shouldn't have, went to war in one country where I don't think we should have gone, but at least if we went there, we should have paid for it. I want to make it clear, when I talk about going to war and what we've done, that our servicemen and women have been unbelievable and effective in what they do. They have my respect and they have my support. And I'll do everything I can to make sure they get the help that they need. But it's not fair to ask servicemen and women to serve 3 and 4 and 5 tours of duty. Some have been away from their families 3 and 4 and 5 years without the type of expected home time. And then we wonder why they have a hard time in adjustment back in this country. The last time I looked at it, the unemployment rate among returning veterans was about 20%. That's not a nation that shows its respect and support for our warriors. They don't have jobs when they return home. Which leads me to the principal way to get our budget back in balance. And the principal way is to create more jobs. We need to create more jobs in America. I talked about 25 consecutive months of job growth. That's great. But we still have way too many people who want to work and can't find work. So what should the federal government be doing? We should be investing in our future. 2 ways we do that to create jobs. 1, we need better highways, bridges, transit systems, etc. Let's build them now so we can be competitive, but also create the jobs we need. We have a bill on the floor of the United States Senate that we passed. If the House passes this transportation bill, it would create a couple million jobs. We need that done. This was not a bipartisan bill. This was a consensus bill. Democrats and Republicans joined together to pass a bill in the Senate that funds our roads, our bridges, our transit systems. We need the House to follow suit. They're playing politics. They're playing politics. The votes are there to pass it. They won't bring it up. I don't know why. Maybe they don't want the president to have a victory. I don't know what the reasons are. But our economy depends on investing in rebuilding America so we can create the jobs we need. And then the second part of that is invest in our children in education. We've got to invest in education. It's way too expensive to send children to college today. It's a real burden on too many families. But that's what we need to do. That's a balanced approach that gets our economy back on track. And by the way, part of that is to preserve the dignity of our seniors. I'll tell you, I'm going to be watching very carefully the Supreme Court decision this June on the health care reform bill. I'm going to tell you, I'm a supporter of the health care reform bill. I don't understand how this case is even in the Supreme Court. Maybe someone will explain to me how the Supreme Court could substitute its judgment with the Congress of the United States, the legislative branch of government, that said we have 40 million people without health insurance in America. 40 million. Now, these are people that are not poor. If they're poor, they're in Medicaid. These are 40 million people who have no health insurance that are not qualified by income to be in the Medicaid system. These are not children, because children we have in the S-chip program. So these are working men and women who have no health insurance. And what do? They don't think they're going to get sick or have an injury, but they do. So what do when they get sick or they have an injury? They use our emergency rooms, and they don't pay their bills. And we pay their bills. You pay their bills. If you're in Medicare, you're paying their bills. If you're in private insurance, you're paying their costs. And what Congress said is that, like what we did when we passed Medicare because there were tens of millions of seniors who couldn't get health insurance or couldn't afford health insurance. Now, many of these 40 million can't find health insurance because it's not offered at work and it's tough to find an individual policy. But in 1965, we had tens of millions of seniors who couldn't find adequate insurance. So the United States Congress, in its wisdom, said that we have to do something about that. We're going to have a mandatory system. We're going to require you to pay a tax so that we can have a federal system to protect our seniors with health coverage. Because we think it's wrong for a great nation to tell tens of millions of its citizens they're left out. So we have a mandatory health insurance for our seniors and our disabled population. It's called Medicare. You have no choice. You must be in Medicare Part A. You have no choice. What is the difference between that and mandatory insurance for the 40 million who don't have insurance today? Where does the Supreme Court draw a distinction between Medicare and the Affordable Care Act? Let me take you back to 1930. In 1930, the Congress at the time, recovering from the Depression, thought it was wrong for a great nation to tell its citizens that if you didn't plan well for your retirement, that we don't want you to be a ward of the state. We think everyone who works should have a guaranteed income flow for the rest of their lives. A guaranteed annuity that's adjusted for inflation that you cannot outlive. And it's called Social Security. It's not a voluntary program. If you work, you must pay into Social Security. It's a required government annuity insurance plan. It's a simple annuity. It's simple to make sense. It's based upon your income while you work. And Frank can help me here because he figured this stuff out. And your money you get in Social Security is dependent upon your income and your credits. It's a mandatory insurance policy that you bought. Because we felt it was wrong for tens of millions of Americans to live in poverty in their senior years. Where does the Supreme Court find that different than the required insurance for the 40 million today? And I can make the same analogy on disability. Social Security has a disability part. That if you get injured or ill, before you reach your retirement age, you can collect disability insurance. It's a mandatory disability plan. You have no choice to join that plan. So, at least since the 1930s, Congress has been moving forward in protecting the citizens of this country against uncertainty. And the Supreme Court has said that that is okay, saying that we are not the legislature. The legislative branch of government will make those decisions. Now, all of a sudden, this court looks as political as I've seen any court in the history of America. And is on the verge of perhaps making one of the worst decisions since the Dred Scott decision, in my view. And I hope it's not the case. I hope they come to their senses. But I tell you, I'm going to wait to listen to what that court is. I'm going to continue to fight for policies that I think make sense for a great nation. And I do believe that the legislature should legislate, not the Supreme Court of the United States. So we'll see what happens in June. I got a little bit off subject, but it's a very timely issue. And a lot in the United States Senate and Congress is sort of on hold, dependent upon what's going to happen in the Supreme Court in June. Well, when I was in the House, and you, Bill, if you would have invited me here, I would have finished 10 or 15 minutes of it. But in the Senate, you have unlimited time to talk about issues. So I've really gotten into it in the Senate. I really thank you very much for giving me truly the honor of representing you in the United States Senate. It's truly an honor. When I look out at what you all have done in your lifetime, and the challenges that have been overcome, from the challenges we had as a nation during World War II, the difficulties that we went through in recessions, the challenges we had in Korea and Vietnam, and and now the threat against us with the threat of terrorists, the challenges we've had to our economy, including the most recent times, we're going to overcome this. We're going to continue to lead the world. We're going to continue to be that beacon of hope for people around the world. We may have our differences in Washington today, but this nation is still the great democratic economic power, and we're going to continue to find the solutions to our problems. I am convinced of that. And every time I come to a meeting such as this tonight and see people who have been on the front lines to help our country, it gives me great confidence and optimism about America's future. Thank you for having me here, and I'll be pleased to try to answer some friendly questions. It's already a little late tonight. Thank you all very much. So, Bill, there's a friendly question right there. It's a brave question.
Do you have any ideas of what we can do to help Congress change their opinions about us? As retirees, especially we have to.
That's a great question.
What can we do as individuals?
That's a great question. Well, first of all, we should put a face on these issues. A lot of times we'll just use the gross numbers rather than talk about the individual people. But I tell you, put a face on the issue. Look at what you all are doing. Look at the incredible work that's being done. People go to NIH and see that research and say, my goodness, these are the brightest minds in the world. They are. Do we really want to tell these people that they're not worth the money we're paying? And I tell you, people, we're the envy of the world on how we administer the Social Security and Medicare systems. They really are the most cost-effective delivery systems of any country in the world. I mean, the administrative cost of Medicare is minuscule compared to private insurance companies. So let's talk about the people that are doing this work, the dedication that they have. And again, I use the analogy of turning on the faucet and having confidence that water is going to be safe. Do you really believe if you didn't have government workers that the private sector would take care of your health needs? Do you really think the air would be clean? The water would be clean? Do you really think our toys would be safe for our children if we didn't have the federal regulatory structures? I mean, let's be straight about it. We understand the private sector is great, it's profit. They want to make money. Government wants to make sure you're safe. They want to make sure that the parameters that we're operating on make sense. To a large extent, it's not an argument about you. It's an argument about government. And, you know, I am a defender of government. I believe that we have a responsibility as a civil society to protect the common interest. That means a strong national defense? Yes. It means a postal system that guarantees universal delivery? Yes. It means food safety? Yes. It means advancing technologies like we do in this, and it also means, quite frankly, having the type of programs that protect the public safety. And they're the things that I'm going to be fighting for. And I want clean air, I want clean water. I can tell you, and I wish we would do this more often, the Republicans who were against government offered an amendment to the Clean Air Act, I guess about 20 years ago, that requires us to do a cost-benefit analysis on every regulation we put out on clean air. Before it can go into effect, the economists have to put a price tag on how much it costs for industry to implement that regulation. And then they also must put a price tag on what is the savings on that regulation. For example, we have regulations that regulate how much mercury pollutants can go into the air. Now, we know how much it costs industry to put scrubbers on their smokestacks. We know the cost. We can document that. And we also know the cost of what those pollutants cause from the point of view of hospital days, premature deaths, and how many people will lose work days taking care of their children because of an asthma attack as a result of pollutant air. And the cost-benefit ratio of these services are approximately 40 to 1. That's not what I'm saying. This is what the experts tell us. So we save about 40 times as much as it costs industry to implement the clean air standards. That's a pretty good deal. So I guess my answer to your question is, the people of this nation are getting their value for what we do in government. They're getting their value. And people like the idea. I don't know how much you want to be caught in traffic, but I think people like the idea that we have transit that can get you a little bit faster. If we didn't have transit, our roads would be totally gridlocked. Totally gridlocked. And they like to have roads. And most people like to eat. And they like clean, and they like good food. It's safe. So I think if you just don't talk common sense, I think you'll get more and more support. And I see that happening. And I see the polling data. The polling data is coming out. The Americans are much more moderate than this extreme element that has taken control of the House of Representatives. I think that's going to change. I certainly hope it does. Yes?
Senator Cardin, I want to thank you for fighting for us. And I'm glad that you're concerned about prevention and clean air. Because one area that's not been looked at a long time that really needs attention, especially for the federal workforce, is indoor air quality standards. As I told you, I have a support group for people with chemical sensitivity. And half of them are federal workers. They've gotten sick in federal buildings because they're working in overcrowded, underventilated buildings with mold problems. And we can't fight the federal government.
Well, it's difficult to fight the federal government, but I can tell you, in my life as a member of the House of Representatives, we took on the federal government with a building in downtown Baltimore, and we made substantial changes in that building. We also had a problem at the SSA building that we very much attacked and got significant changes in order to improve the health conditions of our federal workforce. I don't deny the fact that it's not easy to fight the federal government, but we do have inspector generals, we do have ombudsmen, and we do have elected officials that will make sure that our federal workforce have safe environments. So we treat each of these issues with a great deal of attention, and we have brought about major changes in federal facilities here in Maryland. So I don't want to leave the impression that we can't win these battles. Well, put that one on my list next to get through. I've not heard concerns about the federal workers' comp issues, but we'll be glad to look at your specific. I'm sure that my office has had some concerns, but it hasn't. I'll just point out, it hasn't registered that we have a significant problem to me, but I'll be glad to look at your concerns.
When it comes to things like chronic illness and sick building syndrome, they don't understand it at all. You get lost in the...
Well, without trying to draw a conclusion to the specific issue that you're raising, because you may have a lot of legitimacy here, workers' comp requires medical causation between your illness or injury and your work conditions. It's a medical determination. It's not a subjective determination by a supervisor. It's basically the medical evidence. And I would be the first to acknowledge there may be a problem there, and we'll do what we can to. But it's not a political decision. It's a scientific decision. And if the laws are not adequate or the resources are not adequate for that scientific determination, then we need to correct that. Well, there's no question that if you can show causation between the work environment and an illness, it's an actionable matter under federal workers' comp. The challenge is whether you can show that causal connection. That's the issue. And one in which, as I said, if the law is not adequate and the resources are not adequate, you have my attention on it. Yes? Thank you.
We want to thank you for all that you do to protect our reputation. But our reputation is perceived compared to the reputation that
Amen.
the Congress.
I agree with that. I would take your numbers over mine any day. Yeah.
I know from the emails that I get that you are not
There's a lot of misinformation out there. And with the way that you can communicate today through the internet, it becomes what's known as viral. So it gets echoed and gets multiplied geometrically. And it gets a life of its own. We've seen that happen in our political system on both sides, both Democrats and Republicans. I'm not trying to claim that one party has a monopoly on using this type of communication. But you're absolutely correct on the way that members of Congress are identified. Most people believe that we get these special treatments that in fact do not exist. They do not exist. I'm not going to try to convince you all about that. I'm just telling you that the benefits I receive are about identical to any other federal worker. The health benefits are identical. The retirement benefits are a class that's a little bit different because we don't serve as many years generally. We pay a little bit more in. We have fewer years in order to qualify. So there's a little difference on the retirement. It's not just for members of Congress. It's for groups of people that generally serve less than, it's not a career for most members who come into it. The other issues you mentioned, you're absolutely correct that people have this information, but it's not just the members of Congress. It's the federal workers, it's to the President of the United States as to whether he was born here or not, those types of issues. They get a life of their own that just is something which is, to me, not really in keeping with what a democracy is about. We want people to get the right information. We want you to make your own judgments. I'm not asking you to accept what I say as being the gospel, but we all should have the same set of facts. You know, as I forgot who it was who said that everyone's entitled to their own opinion, but they're not entitled to their own set of facts. So, I mean, we should at least agree on what the facts are. And that's why I said, on a lot of these cases, let's look at the facts. I mean, it's a fact that 19% of our economy was revenues when Bill Clinton was president of the United States. It's true that 19% of our economy was revenues when Ronald Reagan was president of the United States. You might say that's good or bad, but that's a fact. And it's a fact we're about 15% right now. Maybe they were wrong. Maybe they were too big of revenue raisers when they were president. Now, most people would say that times have changed, and we would expect that to have gone up a little bit since that time. But if we just go back to the Ronald Reagan days, or the Bill Clinton days when we had huge surpluses, we would need basically what the debt commission says we need in revenues. That's a fact. You can say, well, that's good or bad, we have different opinions. But let's all at least agree on the facts are. And let's not be party to the spreading of information that's just plain not right. I get those emails, Myrna gets those emails, and many times Myrna will respond to the person who sent it to her. Myrna's my wife, by the way. For those of you who don't know her, she'll respond and say, you know, what you're doing is irresponsible by transmitting information that's just not factual. Yes.
Let's look at what I consider to be a potential tragedy, and obviously you do as well. If the Supreme Court does rule that this required payment is unconstitutional, what then? What can we do to get back to a good health care?
Right. Well, we're going to have to see what the Supreme Court says. I mean, it's very difficult for me to respond until I know how the Supreme Court will allow Congress to respond. There's a lot of different options that they could have. They have 4 cases before them, so we're not exactly sure how they're going to rule. But what I hope they will clarify for us is that I hope they will explain what Congress can do. And can we have a Social Security system? Can we have a Medicare system? And can we have a national health insurance if we want it? I hope they'll clarify that for us. Would they allow Congress to pass a single-payer national health insurance system if they would not allow us to have individual mandates? Would they allow us to have a Social Security system without a dedicated revenue source? But maybe the dedicated revenue source is what they find to be objection. I don't. Again, we have to see how they define this. For the life of me, I don't understand why this is in the Supreme Court. I don't understand the challenge. I mean, one thing I understood the challenge. Now, I listened to Justice Scalia, who, by the way, I think is brilliant. I think he's an excellent judge, who says, well, then the government's going to order you to eat broccoli. Well, you know, give me a break. It's a big difference between 40 million people without health insurance that are a burden to our system and telling people that they have to eat a particular food. To me, there's no comparison. I think that demeans the intentions of the legislative branch of government. I don't demean the Supreme Court. I believe in the Supreme Court. I really do. And I hope they are not going to become a political entity. I don't want them to be a political entity.
Too late.
That's true. You have push before. Yes.
I think for a year and a half we've been trying to apply the common sense arrangements that our supporters believe in. And we get at the end of the Ryan budget passed by the House, which ignores common sense completely. Now, if we can't explain to the politicians in ways that cause them to change, then the other recourse is to remove their power, which means that we have to do better in the next election than we did in the last one. And we have to convince people who are in the middle that and open to persuasion that we are actually talking common sense and what the other side is saying is inappropriate. Now, how do we as an interested party in this make the best attempts to persuade these middle-of-the-road voters, not the politicians, but the middle-of-the-road voters, that they should remove that power from the House?
It's a great question, and I think most voters are moderates. Just to tell you that, I think certainly the what we call the persuadable voters, those who will not automatically vote Democrat or Republican. There's a group that will do that. That most of the independent voters, not people who are registered independent, but most of the independent voters, they may be registered Democrats, they may be registered Republicans, but most of the independent voters tend to want to find someone who is, for lack of a better word, in the center of American politics. They're looking for moderate policies that are not extreme. They believe that we should work together, get things done, and that we don't want our country to have a huge deficit. We want to have a sound security system. We want to have safe food. We want to have colleges that are affordable for American families. We do believe that Head Start's a good program. All children should have a chance to succeed. That's where I think American Center is all about. It's more of a moderate policy. Now, if you take a look at the Ryan budget, this is the budget the House Republicans have come up with. It doesn't add up. And I think moderate voters are going to find out more about this. What do I mean by that? I come back to my point. Maybe liberals and progressives would like to see 21% of revenue. Come back to me. We'd like to see a bigger government. Maybe that's true. There's a lot of unmet needs. We'd like to see those needs met. So we say we don't want to just get back to the status quo. We really want to make college education affordable. We want to double the Pell Grants so families can really afford a college education. They don't have to go into debt to $100,000 to graduate from college. Let's get that down to $25,000. Well, that's going to require a bigger government. Or perhaps we say that the subsidies in health care aren't enough. We think people need more help in being able to afford health care. We need more clinics out there so people have access. So we may think you need more money in government. So I don't want you to think that 19% is what progressives think is the best. But 19% is what historically we've used. The Ryan budget cuts the 15% even lower. They're saying our wealthy are paying too much in taxes. They cut the upper tax rates by even more. They make the Bush tax cuts permanent. That makes no sense at all. And I think a moderate understands that makes no sense at all. So I think you have to, again, go over the facts of what's in their budget. The Ryan budget would say to seniors, we know you need help with your health insurance, so we're going to give you a voucher. The voucher is going to be worth about $6,000. Not a big deal. You're going to get $6,000. And now they're going to tell you, you go out and find a private insurance company that's going to insure you, because we don't like government insurance. We don't like government. We didn't like it, so Medicare D only has private insurance. There's no public insurance for prescription drugs. We're going to do the same thing with your hospital and doctor bills. Talk to a private insurance company. And here's the catch. Private insurance companies don't particularly like you all. It's nothing personal. Private insurance companies like to make money. And the older you get, the more claims you make. They want people who don't make claims. So they like younger people. It's a fact of life. As you get older, you're going to need more health care. You all know it. So private insurance companies aren't exactly going to be out there with a red carpet welcoming you, but okay, they're there. But now they can charge what they want to. And we're estimating that they're going to charge $12,000 rather than $6,000 for the benefits that are currently under Medicare. That's not all the benefits. As you know, if all you have is Medicare, you're going to incur a lot more expenses. But to get the Medicare benefits, it's going to cost you $12,000. It's going to cost you twice as much. Can seniors afford that? The answer is no. They can't. That's a fact. Seniors have the highest out-of-pocket cost of any great age group of Americans for health care, even though they have Medicare. So I come back to the Ryan budget. It doesn't make sense for seniors. It doesn't make sense for students. The Pell Grants are going to be cut. It doesn't make sense for a fiscal conservative because the deficit's going to go up because you don't have any revenue. It doesn't make sense. It doesn't add up. So I'm agreeing with you. I think if you explain that, moderate voters are going to say no to the Ryan budget, to what the Republicans are trying to do. Now, again, I'm not trying to tell you that progressives are going to embrace all, I'm not saying moderates are going to embrace all the agendas that a progressive may want. And we may argue over that. But I think what Americans want today, they want Democrats and Republicans working together. That's what they want. And I'll tell you something, that's what I want. I believe I'm going to fight as hard as I can to elect as many Democrats in the next election as I can. I'm partisan. I'm going to elect Democrats. Once the election's over, I'm going to work with Republicans to get things done. That's what most Americans want us to do. This Tea Party doesn't believe in negotiating. They don't believe in compromise. I don't know how you work with a group that doesn't believe in compromise. We wouldn't have the United States if it weren't for a compromise. How do you think we have the House and Senate? That was a compromise. I believe in compromise. I worked with Republicans all my life. I've gotten major bills done on pensions, on health care, on environment, on human rights, because I've teamed up with Republicans to get it done. That's what has to happen in our political system. So all I ask you, this is not a partisan meeting, so I'm not going to ask you to vote Democrats in November. If you come to one of my political meetings, I'll ask you to do that. But I'm not going to ask you to do that tonight. What I am going to ask you to do is, you should really press people who you want to support in the next election, whether they're prepared, when the election is over, to put their own views in perspective to the nation, and be prepared to move this nation forward. The greatest threat to America today, in my view, is the failure to give predictability to the private sector so that our economy can take off and we can create jobs. When you have a budget out there that nobody knows what it's going to look like, you've got a tax code that no one knows for sure what it's going to be, that uncertainty is hurting America. So what I want from people who I want to vote for are people who are going to tell me they're going to put the nation's interest first. And they're prepared to take the will of the voters in November and work with whoever's elected and provide the leadership to make decisions to move our country forward. And are prepared to compromise in order to get this nation moving forward. That, to me, is the principal issue in the 2012 elections. And I hope the voters will be asking all of us that question. And then looking for those of us who have been in office, what we have done about that while we've been in office. for those who are challenging, whether they really are prepared to say, I'm prepared to go against the Ryan budget or going against the Pelosi budget, I'm prepared to say no to my own party in order to be able to move this country forward.